Healthcare Settings. Where do CNAs work? A presentation by 4YourCNA.com. Nursing assistants, sometimes called nursing aides, can work in a variety of healthcare settings. They're in high demand, and government projections show an industry growth rate of 18% over the next 10 years for nursing assistants. Analysts expect about 60,000 new CNA job openings every year. But you're in good company. There are already 1.5 million CNAs currently working in healthcare in the United States. So where do all those CNAs work? Most people think of hospitals and nursing homes when you think of common work settings for CNAs. And yes, these are two of the most common places CNAs work. But they aren't the only places that CNAs can work. There are lots of other job opportunities for CNAs, many with exceptional industry growth rates. This presentation will review several different work settings for CNAs, some you probably haven't even thought of. It's important to understand some basics about healthcare settings before we get into specifics. Let's review some terminology first. There are 3 basic healthcare settings that we need to be familiar with: acute care, sub-acute care, and outpatient care. Acute care is specific, immediate care for a short-term problem. This is what hospitals and surgery centers specialize in. The care in this setting is fairly constant due to the severity of the illness or injury. Acute care will include care by many providers like doctors, nurses, physical therapists, radiology, lab, respiratory therapy, social services, etc. They stabilize patients, and the care provided is generally focused and brief. Subacute care is a longer, lower intensity version of acute care. Doctors, nurses, and therapists will provide care in this setting too, but the care is less frequent. Subacute care is provided in rehabilitation centers, mental health hospitals, nursing homes, etc. Outpatient care is the most common type of healthcare. More patients are receiving outpatient care every day than any other type of healthcare. So now that we have an overview of the different types of healthcare settings, let's see how this affects CNA employment. Hospitals. Hospitals are the #1 job choice of most CNAs when they enter training, but only 25% of CNAs actually work in state, local, or private hospitals. Some hospitals require CNA certifications, others don't. Some hospitals use the terms patient care assistant, patient care technician, or nurse technician. If you enjoy working in a fast-paced, highly technical workplace with a constantly changing patient load, then a hospital might be the right place for you. CNAs in the hospital work closely with the healthcare team, and good observation and communication skills are a must. Surgery centers. Surgery centers perform routine, scheduled procedures on stable patients who are expected to recover quickly and return home the same day. CNAs often work in surgery centers to help prepare the patient for surgery and assist the patient as they recover from anesthesia. If you enjoy constantly changing, fast-paced environments and are comfortable with learning new skills and working closely with other healthcare professionals, then a career in a surgery center might appeal to you. Rehabilitation centers. Rehabilitation centers offer therapy and nursing services to patients who are recovering from surgeries or illness. They help patients regain independence or learn to accommodate for disabilities. CNAs are often employed in rehabilitation centers. They may also be called rehab aides or rehab techs. If you enjoy seeing patients improve, a rehab might be the right choice for you. Patients stay 6 to 8 weeks on average, so the setting provides a good balance of routine and variety. Nursing homes. Nursing homes employ 41% of all CNAs in the United States. In fact, more CNAs start their nursing careers in nursing homes than any other setting. Some nursing homes provide on-site training. Others will reimburse you for the cost of your CNA training if your nursing home hires you right out of school. If you enjoy predictable routines and getting to know your patients well, then a nursing home might be a good fit. Nursing services, including medications and wound care, are provided at nursing homes, so you'll be working closely with nurses in this setting. Assisted living facilities. Assisted living facilities, or ALFs, provide routine, non-medical care in a congregate home-like setting. Think of it this way. This is like an apartment complex for people who need some help with bathing, dressing, grooming, and need meals provided. Nurses aren't required here because the care is non-medical. If you like working with the same patients all the time and you do well with routines, then an assisted living facility might be the right work environment for you. No advanced skills are required to perform basic personal care for others, so there's little to learn in this environment. Hospice. Hospice can be provided in the patient's home, in a nursing home, or in a hospice center. Hospice care provides dignity at the end of life, so the focus is on keeping the patient comfortable. Hospice care will include nurses to manage symptoms, CNAs to provide personal care, and social workers, clergy, and counselors for additional support. You must have compassion, empathy, and strong patient care skills to work in hospice. Experience is generally required. You must be able to remain calm and reassuring in an emotionally charged atmosphere to provide effective care. This can be a very rewarding setting to work in. Mental health centers. Mental health hospitals offer inpatient and outpatient treatment to help those struggling with mental health issues learn healthy coping mechanisms and how to effectively manage their illness. Caring for patients in this setting is usually less focused on providing physical care and more on helping the patient develop independence. CNAs can be expected to provide encouragement, set boundaries, maintain a safe environment, and promote participation in tasks. Home care. According to the Occupational Outlook Handbook, the need for home care workers is expected to grow by 38%, the highest percentage of all healthcare settings. That means that there will be more job opportunities in home care than any other healthcare setting. If you enjoy providing routine daily care to one client in a home environment, home care may be for you. You must be motivated, compassionate, adaptable, and able to work with limited supervision or assistance to perform well in this setting. Adult daycare. Adult daycares provide short-term care of elderly persons while the primary caregiver is unavailable. This care usually is provided in a structured setting, such as an assisted living facility, and will provide meals, entertainment, and personal care assistance. Other settings. There are many other settings and specialties that a CNA can consider for employment outside of the traditional medical settings. Schools. CNAs can work in a variety of positions in a school. Clinic aides work in the school clinic, and paraprofessionals work individually with disabled students in the school system. CNAs can also be assigned to classrooms that care for medically fragile children. Prisoners must remain in a secure environment, so most medical care is provided right inside the prison. Prisons and jails usually have fully staffed medical centers that function just like hospitals and nursing homes in the community, so CNAs are needed here too. Dialysis centers hire CNAs to assist patients who are undergoing dialysis and are confined to a chair during the procedure. Additional skills are generally required and often provided as on-the-job training. CNAs can work under the direct supervision of a nurse in any setting, including offices. CNAs in this setting would assist with obtaining patient information, taking vital signs, and helping with procedures. CNAs are also hired in research offices to assist with information gathering and patient visits. Veterans often receive their medical care in VA offices, hospitals, and nursing homes. CNAs provide the same care for the VA system as they do in a community setting. This is a great way to show honor for those who have sacrificed for our country. CNAs can also work in pediatrics, caring for severely ill and injured children in the child's home, in a pediatric daycare setting, or in a children's hospital or nursing home. Additional training may be required after hire. There are many other settings that CNAs can work in that may not have been covered in this presentation. Search jobs boards, network with friends and family, and watch for openings in your community. How do you know what setting is right for you? You have to evaluate your own strengths and weaknesses. Do you like fast-paced environments, or are you easily overwhelmed? Do you like routines and predictability, or are you easily bored? Do you like to learn new skills? This chart will show some common workplace traits. You can evaluate your own strengths and weaknesses and make a decision on a workplace setting that's right for you. Now we've seen that there's more to nursing than just hospitals and nursing homes. Don't be afraid to branch out and look at other settings for CNA jobs. You might find a setting that's perfect for you.